for today's Lutheran LCSNW Mental Health Matters Lunch and Learn webinar. First, we want to apologize about yesterday's cancellation, but we're really happy that those of you who could attend today came and joined us today. We had some technical difficulties that we were able to work through, so we're really excited to be able to come and share with you today. Before we begin the webinar, I have just a few things I would like to go over with you in regards to the webinar and how this process is going to work. First, we are in Zoom and webinar mode, so your video and audio will be off and it will remain off for the duration of the webinar. However, you can access us through our chat and through our Q&A function. So if you have any questions or need information, please keep an eye out on the chat. And if you have questions, please go to the Q&A function that will be open throughout the webinar. And that is just below the screen, and on your faces, you'll see a function that says Q&A. All questions will be facilitated through that function, and we will be answering some of those questions live at the end of the webinar. So please feel free as we work the webinar to put your questions in that Q&A function. Since we are at our lunchtime and we're going to have everybody with their videos off, please feel free to eat your lunch, do what you need to do, but we'd love for you to listen to what we have to share today. We will also have an email address for you at the end of the webinar, and you can send any follow-up questions, information about the agency or anything that we've shared. You can send those questions to the email if you prefer than sending them through the chat or the Q&A. Okay, so why are we here today? First off, we'd like to start off by just sharing a little briefly about Lutheran Community Services Northwest. We are a Pacific Northwest social service agency that supports and impacts families and communities in and around Washington, Oregon, and Idaho. We offer a variety of different services based on the needs of the community that we are serving. And some of those services include mental and behavioral health, refugee and immigrant services, child welfare, victim advocacy, and aging and independent living. So here in the Tri-Cities, we are kind of focusing on mental and behavioral health. So we are hosting this webinar today. And we decided to kind of set up this webinar because we noticed and we've seen as our world continues to be a scary kind of place, our mental health is impacted, whether you're a victim, an observer of traumatic news and stress that we kind of see all around us. We all have mental health and we know how to care for ourselves and others, but we need to make sure that we're caring for our whole selves, which is our mental health, including our physical health. We are here to share today why mental health matters to all of us, how LCS is supporting communities locally and across the Pacific Northwest, and the importance of mental health first aid. Today, we have 3 panelists from our Tri-Cities office here who are experts in their field, and they're going to be sharing some information that we feel is relevant to everybody. Just a quick reminder, at the end of our hour, we'll be answering some of the Q&A questions, like I had mentioned earlier, live, and also this webinar will be recorded for future viewing. So if you have to jump off or you know somebody that wasn't able to attend, please know that we are going to record this and send it out via email. All right, so let's get started with our first panelist. Our first panelist here is Alvis. Alvis is one of our behavioral health and mental health clinicians in our office. He specializes in trauma, depression, anxiety, focuses on supporting teens in our community, and also specializes in CBT, play therapy, and is a dual language support. So without further ado, let's welcome Alvis.
Thank you, Amy. So like Amy was talking about, some of the areas that we're going to be focusing on today is going to be the mental health and kind of a little bit about what that is. And, you know, like mental health matters to all of us. And it's important for us to be able to have a good understanding of what mental health is and what is the difference between mental health and mental illness. So here on the slide, it talks a little bit about mental health, referring to the cognitive, behavioral, and emotional well-beings of individuals. You know, it talks about how we're feeling about ourselves, how we're interacting with other people, whether if that's in a social setting at work, at school, pretty much anywhere in a setting where you're having social interactions with individuals, and our psychological state of mind. It's important to have a good understanding of that, of where you are in those states of mind, to be able to help identify like what the status of your mental health is. When we look at the mental illness, it's conditions that affect your mood, thinking, and behavior. Mental illness comes from different forms of symptoms regarding, each individual person. And, this is where we hear a lot of the different types of mental illnesses, whether if it's depression, anxiety, mood disorders, bipolar disorders, personality disorders, schizophrenia, trauma disorders, eating disorders, or addictive behaviors, or risk-taking behaviors as well. A lot of these things, could be developed from our early childhood and adolescent stages of our life, up until, our adulthood of, we're going through a lot of things, or we have been through a lot of things. So it really plays a big part in, where our mental state is, or could be as well. So at the end also, there's going to be a lot of reference points of where a lot of this information comes from as well, if you're interested in looking into that, or if you have any questions about that kind of stuff as well. We're looking here at stress and trauma. It's important to be able to have a good understanding of what that is and what that looks like for each individual, because as everybody knows, we're definitely at a time where we're all experiencing a lot of different things, and and it can create high levels of stress, and whether if we're experiencing traumatic events as adults, or past traumatic events have happened, or high anxiety events as well, whether if that's social anxiety or just anxiety in general as well. It's important to be able to understand that. And when we're thinking about that today, we're thinking a lot about what is happening in our society, and what really is going on, and why are these things coming up now? Why are we seeing a large increase, whether if it's in adults or young children or adolescents, of where is all this coming from all of a sudden, and why are we seeing these high numbers of things? There's a lot of factors that play into that, whether if that's, a lot of the social things that are going on, when we have a lot of our refugees from coming in from Ukraine, from war-related events, food shortage, inflation. A lot of these things can cause people to feel stressed out, and put a heavy burden on them of, how am I gonna feed my family? How am I gonna feed my infant if there's a formula shortage as well? And can bring up a lot of those feelings that we've experienced in the past as well. So when we talk about stress, and what does stress do to our body, a lot of the things that a lot of us probably have felt before in the past, we were talking about headaches, having heartburn, rapid breathing, high increase of having heart attacks, fertility problems, menstrual problems as well, lower sex drive. We're talking about high blood pressure. Our immune system is not what it used to be. We're feeling like we're getting sick a lot more often. We're having a hard time falling asleep and staying asleep, or we're having a hard time being able to control that. A lot of these things are affecting us on our day-to-day basis, and it's really difficult to have an understanding of, how do I work through a lot of these things that I'm going through, to be able to return back to what we call, our normal function of, before I felt all of these things, how can I go back, and how can I overcome a lot of these things? And a lot of that takes being able to understand of, this is what I'm going through, and I need to be able to seek help, especially, when it comes to traumatic events that we've experienced in our life of, hey, I need to be able to find, how am I going to process a lot of this traumatic events that I've experienced, and that's where we have a lot of the trauma focused therapy sessions of, like, they're solely focusing a lot of these traumatic events that have happened, and how can we help have a better understanding of, how does that affect our brain, how does that affect our body, and as well as our emotional response of like, how is this affecting all of these different aspects, you know? And if you're not receiving that kind of care, you know, there could be a lot of those high increases of negative impacts on physically and emotionally as well if it goes untreated. So a lot of that stuff is why it's important to have early intervention, whether if we're seeing it on ourselves, if we're seeing it on our kids, the youth, if you're working with individuals of a certain age, being able to identify those things to be able to get them to the services that they require. So we can kind of get a lot of that stuff to get that work put in to significantly reduce a lot of those negative outcomes that come into our life later on down the road, because we never really addressed a lot of those issues that were going on. So it's really important to be able to identify that. You know, when we're talking about what does that mean, where do we get that kind of help? I think a lot of, you know, there's a lot of mental health crisis, not just in our state, but in every state as well. So it's important to be able to understand, you know, like we have a high need. You know, there's a statistic there that about 37% of the US population, 122 million Americans are living in areas where mental health professionals have a shortage. We just don't have enough people to be there to provide that kind of support. And here in Washington State, that's about 36.87% that live in areas that are underserved from services and mental health. Mental health workers or substance abuse social workers in the US, it's right now currently sitting at about 116,000 employees of that area. So it's important to be able to have that understanding of what are the services that are available. If they are limited services, it's important to be able to identify that as well. You know, we've seen a large increase of suicide attempts here locally in Benton Franklin County since 2010. You know, in 2010, we had 12 reported suicide attempts that have been recorded. In 2019, that number jumped up all the way up to 72. So you can only imagine what that has looked like in the past 3 years since then, of if we went from 12 in a matter of 8 years all the way up to 72, what that could look like as well. So it's really important to have a good understanding of what are the services that are local to me, how can I get services, how do I refer myself, and how do we go about receiving all of these services that are going to be a lot helpful, whether if it's to ourselves or to other people as well. So it's really important to be able to have that understanding. You know, when we're talking about what is being done, you know, there's a lot of things being done on the federal level of being able to distribute a lot of aid to a lot of these states and a lot of these counties to be able to provide a lot of those, whether if it's trainings or start of new businesses that are able to provide mental health services, you know, and there's a lot of those things that are being put out there to help individuals. You know, that statistic there at the bottom of that slide, it says $250 million to increase access to mental health workers to provide 24/7 comprehensive care or a crisis response is being awarded to be able to set up those kinds of services for individuals. You know, the White House has acknowledged we do have a mental health crisis. We do have a shortage as well of mental health workers, and how can we get these people the help that they need? So it's really important to be able to have that understanding of how can we do that, how can we help ourselves, and how can we help other individuals that might need our help in receiving a lot of those services as well. So, you know, in a couple more slides here, we're going to talk about, you know, ideas of how can I help myself? How can I help myself with my mental health, my mental illness that we're going through? What can be done? What can I do to help me overcome a lot of these things that I'm feeling as well? Yeah, so I think, you know, we're going to be moving forward. Kayla's going to talk a little bit about what is it that we do here at Tri-Cities Lutheran Community Services.
Thanks so much, Alvis. Appreciate you coming in and sharing all that information. I know that they are dropping some links in the chat in regards to both our local here in Benton and Franklin counties, as well as if you click on the link, you can actually get Washington State's mental health trends. So if you're in a different county, a different area, please click on that link and it'll let you know what's going on there, as well as the information from the White House fact sheet. Okay. Thanks again, Alvis. All right, so moving forward, we have Kayla here. She is a program director here at Lutheran Community Services and has been with us for about 2.5 years. But additionally to that, Kayla has been in mental health fields for over 15 years, and specifically a lot of work in the clinical case management work. So thank you, Kayla, and we are looking forward to hearing you talk about LCS work and wraparound.
Hi, thanks, Amy. Okay, so I'm going to share just a little bit about our history. So Amy kind of mentioned that the agency that we now know as Lutheran Community Services Northwest is operating in the Pacific Northwest, and we've been here for just over 100 years. Last year, we celebrated our centennial. And currently we've got offices located in Washington, Idaho, and Oregon. Our first office in the Tri-Cities was established in 1964. And the focus at that time was also on mental health as well as marriage and family counseling. So in the last 58 years, our community has grown quite a bit. The needs of the community have changed. And as an agency, we have been listening to what the needs are and trying to help kind of fill some of those needs. So in the early 2000s, we offered a broad range of services, covered a little bit of a lot of things, but that included services specifically for youth and families. Our community identified that there was a gap in services for youth and families, specifically with intense needs. And as Lutheran was providing some of those services already, we kind of started shifting our services to really focus on that population. About the same time, wraparound was introduced in our community. If you're not familiar with wraparound, I'll be talking a little bit about what that is and why we use that in the way we serve individuals. So wraparound was introduced in our community, and our leaders at the time really quickly realized the benefits of what that program could be and decided to implement that service. So our Three Rivers Wraparound program started in 2003, sorry about that. Fast forward to 2014, Washington State introduced WISE, which is Wraparound with Intensive Services, which today is a statewide Medicaid program. Lutheran was one of the first providers in the state since we were already doing wraparound services. So today we have 3 offices in the Tri-Cities, 2 in Kennewick, 1 in Pasco. And we offer, like I mentioned, we offer services specifically for youth and families with intense needs. So in addition to the WISE program, we also have our SWIFT program, which is a 90-day short-term crisis stabilization program. And that program has also been here in the Tri-Cities for a number of years. So specifically geared towards helping youth in crisis to get stabilized and get connected to resources in the community so that they can be successful. We also have a contract with the Juvenile Justice Center. We provide mental health services inside detention. And we recently partnered with a local school district to provide mental health services directly in the high schools. So we have 2 mental health clinicians and 2 case managers who work directly in the schools, providing mental health services, connecting individuals to resources that exists in our community. Okay, so next slide. Yep, what is wraparound? So I mentioned we're going to talk a little bit about this, and I know that we're not all here to talk about what wraparound is, but as we talk through it, I'm hoping to bring some attention to the why we use wraparound and how it also works with not just youth and families in crisis, but in the way that we manage our mental health. So on the slide here, you can see the 10 principles of wraparound. I'm not going to go through all of them, but I'm going to pick a couple out. So one of the cornerstones is family and youth voice and choice. And what that means is that people get a say in the treatment that they're being provided. Where meetings happen, at their home, at school, what kind of activities and things they think are going to be useful in their lives. They get to pick, what are their goals? What are they looking for? What is their life moving forward going to look like? And that may seem kind of simple, but it's really, really important to have ownership in your life and where it's going. Another one that's really important is natural supports. And so natural supports are the people around you in your day-to-day life. So we can differentiate that from the professionals in your life. You may go see your therapist and work on some things, but you also have people around you naturally, friends, family, your favorite cashier that you see every week when you go grocery shopping. Those are the type of people that we can really bring in to help support us in our lives and our mental health and connecting with the community that we live in. People don't live, especially youth, don't operate on their own, right? We've got families, friends, and then the community at large that we all live within. And so being able to really reach out and get that support is really useful. Strengths-based is another one that I wanted to point out too. When we're looking at making changes, we focus on this, we use the strengths that already exist within ourselves to help make those changes. Focus on the things that we're good at, that we like, that we have going well in our lives to help change the things, whether it's behaviors or in our mental health in general. Really using those strengths helps to make those changes and more long lasting. The wraparound process also focuses on being proactive instead of reactive. So when we're talking about mental health, there are certainly times of crisis where we need to act, and we need to act quickly. And that is reactive planning. So making plans around specific behaviors and things that are happening. But we also really want to focus on being proactive, which means we're not just waiting around for something to happen before we address it. We're making plans in advance, knowing what could happen. So maybe we're even able to prevent it. And if not prevent it, maybe even decrease the severity. So proactivity is another really important part of wraparound that I think ties well into anybody's mental health. So we don't need to wait to get to a point of hopelessness or helplessness. We can be proactive about it and start thinking about it and planning around it before we even get there. Okay, next slide, please. So here's just sharing a little bit of data that has been collected specifically on WISE. 1/3 of the youth who enter WISE have serious thoughts of suicide. And this isn't really just specific to WISE, right? It just gives us a picture of what's happening in the youth in general in our community. WISE helps. 77% experience a decrease in suicidal thinking within 6 months, and then 90% within a year. What that tells us is that youth who encounter WISE feel more hopeful about their future. And that's really a huge impact. This data also shows us a 15% increase in optimism and resiliency. So even just being more, having a more positive outlook on what could happen in just 9 months of being in the WISE program. And then 33% decrease in challenges impacting family life. So, and that's one other thing about wraparound, as I mentioned, connecting with communities and stuff. It really helps also to strengthen the families. We're not just looking at the youth who's enrolled in the program, but looking at the whole family as being healthy and whole and successful in the future of their own choosing. Since 2016, I think we've served about 1,000 individuals across our programs here in the Tri-Cities. We receive an average of 24 referrals a month. And during the last 2 years, there were months where we saw that number reach almost 40, which tells us that the need continues in our community. And not only that, but it's increasing. And as you talk to people and think about your own family and lives, you've probably seen this as well. So in April of this year, we opened our 3rd office in Pasco, really to help increase access to individuals in more rural areas, places that are a little further from our other offices. And then we continue to look at what our community needs. Alvis mentioned we've got a workforce shortage in mental and behavioral health. And so given that that's the case, how can we adjust what we're doing to continue to support our community in the best ways that we can? So some of the things that we as in our office are thinking about are the crisis services specific for youth. That is a need. And so we're thinking about how we might do that. We're also considering outpatient services to maybe serve a broader range of individuals, not just youth with intense needs. So expanding our the individuals that we serve to maybe help meet more of those needs. And while some of this feels hard, it is hard. But it also really gives us an opportunity to re-examine how we're doing things, how we think about things, opportunity to get creative in how we're recruiting, how we are retaining our current employees, asking them what does our workforce need, how can we support those that are doing this really important work. So while it is hard, it's also given us some really good opportunities to get creative and continue to see how we can help meet our community's needs. I'm gonna pass it back over to Amy.
Okay, great. Thanks, Kayla. A lot of great information. One thing I wanted to note that I noticed, having been in the part of Lutheran for almost 6 years now, and I was a WISE care coordinator at one time. 2016 was after we had been having the WISE program for about 2 years. And we saw, when I came in 2016, we saw a 300% increase that year in services needed for WISE. So, and that has only increased since then. So if that isn't proof that we need some more supports for our youth and families across everywhere, that data speaks for itself. All right, so next coming up to speak and talk to you guys about one of the ways that we at Lutheran are trying to provide anybody and everybody with more information on how they can support somebody who may have a mental health challenge or crisis, or may just need to know, you might just need to know how to talk to someone who's struggling, because every day we come in feeling a little different. So I'd like to introduce Victoria. Victoria is one of our mental health first aid instructors. She provides classes across, we've had people take classes from her in Oregon and across the state. She provides classes both in person and virtually. Victoria has been with Lutheran for 5 years, and she's currently a care coordinator in the WISE program. She is a certified peer counselor and is certified in mental health first aid. So without further ado, Victoria, let's hear about mental health first aid.
Awesome. Thank you so much, Amy. Thank you guys again for joining us. I'm super stoked to talk to you guys about something I'm really passionate about. You'll see up here on the screen, like, I want you to envision if we thought about mental health and gave the same advice we give for mental health towards physical health. You'll see some examples on here as of like, have you tried, like not having the flu? And I'm sure all of us can go back in our minds and think about a time where we were going through something really difficult, or we were just having a blue day and somebody said a statement like, well, you have so many things to be thankful for, or it could be much worse, right? So we've learned over time kind of how that feels, which isn't great. We've mentioned, Alvis and Kayla have both mentioned the shortage that we have for mental health professionals and offering that support. And I think the awesome thing about mental health first aid is it gives an opportunity for us to still be a difference in that aspect. Mental health first aid allows the opportunity for us to learn how to be good listeners. Sometimes that can be difficult, especially when we're working with young adults. We've experienced that they view help a little bit differently than we do as adults sometimes. And mental health first aid allows us to learn how to respond to those youth. We also go through what helplines and immediate resources we have available. We know in far and wide in communities that is a challenge, but we nail down some of the ones that we do have. And we also talk about self-care. Oftentimes, mental health first aid is referenced to physical first aid. We know that we need to ensure that we are full and we are able to provide care before actually doing it. We're not able to pour from an empty bucket. So mental health first aid covers some of those things. We'll be able to navigate a little bit more about what it feels like to provide that first aid, what tangible steps that we can take. We know that we're not all able to be mental health professionals or clinicians or doctors, but we are able to make a small, now I would argue that it was small now, a large impact after we've seen some of the data in our day-to-day lives. So we'll talk a little bit more on what mental health first aid is. One of the big things about mental health first aid is it helps us identify, understand, and respond to youth who are in crisis and non-crisis situations. There's also a little blurb on how to respond to substance abuse challenges, but making sure that we're able to navigate those initial skills. And we get to go through something that's called an algae plan. So we get the opportunity to talk about that, and we'll go into a little more depth. Oftentimes, we hear a lot of different things about mental health and what that looks like. And we know that there's a lot of stigma that continues around that mental health conversation. We debunk some of those myths. One that might be heard very often is if you ask somebody directly about suicide, it almost plants some sort of seed in their head to complete. We get the opportunity to debunk those myths during mental health first aid and some other ones that come with that. We had a really cool experience in our community here locally, where there had been a challenge at a local high school about some youth who have died by suicide and being honored during the graduation ceremony. And one of the attendees of the youth mental health first aid training had the opportunity to work with other community people to go through and debunk that myth that if they were to talk and honor those situations in that local high school graduation ceremony, that it would prompt a seed in the other students or even in the audience to think about suicide. I know it can be uncomfortable to talk about, and I want to honor that and respect that, and be able to walk through with people what that looks like to be able to have confident and bold conversations with people who are having a mental health crisis. And I think that is the impact that we're able to make as a community while attending mental health first aid. We get to be a small blurb of that. So you might ask, why are these skills important? So you'll see some statistics up on your screen. 64.1% of youth with major depression do not receive any mental health treatment at all. So we know that there is a huge lack in that professional help that we are talking about. But youth mental health first aid teaches us that if you are one caring adult in a youth's life can make a difference. Also, 5.13% of youth have substance use or alcohol problems. And 1 in 5 teens and young adults live with a mental health condition. I think that has probably expanded since we've had the pandemic and all the different societal things that Aldous chatted about, and how difficult it is to be able to manage social media, which we know is a huge thing, or manage peer-to-peer relationships or family relationships on top of some of those traumatic things that youth could have experienced in the past. So this is why these skills are important. What we teach in mental health first aid can be utilized on a daily basis. So it is not limited to, we learn this in class and then we are not able to move on and go forward from that and utilize these skills at any time. Although I teach this on a professional level, I use it daily on a personal level. I have experiences with my younger brother who has mental health challenges. And being able to provide these skills, to know them and to teach them to my family on a personal level has been able to impact us in a different way. So I can speak from a professional and a personal view about how important it is for us to learn, to know, and be that one caring adult to utilize these skills. We know that oftentimes we're not able to recognize when a youth or family member or adult in our lives, or even at the grocery store, is experiencing a mental health challenge. Youth mental health first aid, allows us to recognize those signs and symptoms. Some things that we might not expect when a youth is experiencing a mental health challenge, such as giving away social media passwords. That one always comes as a surprise to everybody. But those are things that we see more in our society, how technology hasn't gone through and improved in good ways and not so great ways with young adults and adults in our community. So we're able to recognize those signs and symptoms of a mental health challenge. We're able to be that one caring adult and utilize the skills that we have the opportunity to learn in that training to continue to make an impact in our community and in our personal lives. I think I get extremely passionate about this piece when we talk about how it can continue to impact our community. We know that the need is there. We know that the need is present. And this training allows us to be universal inside our community, across the state. Offering support is something that is wide ranged And oftentimes doesn't matter if there's language barriers or anything like that, kindness and recognizing things. And like I said, being that caring adult really makes an impact in youth. And we go over additional statistics and how that changes as well throughout our training. So one is mental health first aid. We talked about this a little bit, identifying and understanding and being able to respond when youth or adults are in mental health crisis. So here at our agency, we offer multiple youth mental health first aid classes, some of them being virtual or some of them being in person. There is also adult mental health first aid that we offer. Which there will be a link dropped with the classes that we have out for the rest of the year. The really fun thing and what I love about this training is it's really interactive. I tell attendees when they come to see me to go through the training, you're gonna get out of it what you put into it. So we have the opportunity to do a lot of activities together, to explore some different scenarios together and walk through those, how you could use those skills. Creating an algae plan, which is an acronym for the steps that we utilize to respond to youth or adults in mental health crisis, which you'll see our nice koala there on the screen. His name is actually Algae. So we're able to connect that to something that's cute and memorable. A lot of people ask, how long does this take or what does that look like? So for the in-person trainings, it is a full day training. I know oftentimes time is of the essence and that can seem like a lot, but keep in mind, this is an opportunity for us how to respond to youth who are in crisis. We want to honor those youth and adults that we respond to, and we want to make sure that we are knowledgeable and have what we need. And this is a certified class as well. So time is present. We want to make sure that we are aware. And then for our virtual training, it is only 4 hours of instructor-led training, but there is 2 hours of pre-work prior. So altogether, it's about 6 hours, and we just have the opportunity to learn together in this type of platform. Like I stated before, there's a lot of tangible skills that we learn here. That's why we want to make sure that we honor that time and really have the opportunity to practice those tangible skills. A lot of the interactive training portions of mental health first aid is having the opportunity to practice those tangible skills, to have really rich conversations around how exactly can I use this stuff that I'm learning if I was in a grocery store and responding to somebody, if I was at a family event. We take the time to dig into those and allow people who are attending the training to feel confident in those things and ask questions. So when they leave, they're prepared to administer mental health first aid. So how you guys can be a difference. Like I said, it takes that one caring adult that can make a difference in youth's lives. There is a code there that you guys are able to scan. I know there was also a website drop in the chat there where you can register as well. And it's a free training. There's nothing better than something free that can make an impact. So that is awesome. Their movement for mental health first aid in general, be part of one of the million. We can't change the world, but you can be a one person who can make a change and be able to use these skills and respond to youth and adults who are going through mental health challenges. Also, there's additional info on the mentalhealthfirstaid.org website. They have all kinds of resources, articles, different trainings that they offer. Mental health first aid goes above and beyond just what we offer here at our agency. So if you want to get curious around that, feel free to check out that link as well.
All right, thank you, Victoria. Like I mentioned earlier, we're going to talk a little bit about the tangible ways that you can help yourself and how can I help myself with like my mental health, mental illness, any kind of those challenges that are going on. So I have a few bullet points of things that you could possibly try and do. One of those things is aromatherapy. We all know how our sense of smell plays a large portion of what we think of things of times. You know, being able to have good memories about the things that come to mind, that we've experienced, kind of based off of the smell of things. I personally have a bag full of candles that I use during some of my sessions with kids, that kind of help guide conversations about, you know, what kind of memory does this kind of smell trigger. So it's a really good way to help you kind of have a moment to yourself of being able to remember some of the things that have been positive in your life based off of your sense of smell. Avoiding social media. Everybody knows kind of how social media plays a big part in our everyday. But you know, there's pretty important questions that need to be asked when we're using social media, such as how much time are we spending online? How much is it taking away from our healthy offline activities? You know, is it preventing you from going out and doing the things that you like to do outdoors in nature, that don't necessarily include social media? You know, being able to exercise, seeing your friends, reading, sleeping. You know, sometimes it's very easy to get caught on social media right before bed, and you spend hours on hours seeing those kinds of things. And also, what kind of content are we consuming? Are we consuming content that is making us feel good about ourselves, or is it doing the complete opposite? Is it making ourselves not feel so great about the way that we see ourselves, we feel about ourselves, or that we think about ourselves as well? So it's really important to be able to ask yourself those kinds of questions. Making yourself available, you know, making yourself available for your family, your friends, you know, your community. Helping others is a great way to kind of get connected with people. It helps build a sense of purpose, develops your own sense of self-worth. You know, being able to help people gives us that sense of you're doing something beyond yourself that is helping other people. Those kinds of things kind of help us feel good about ourselves, and you know, it helps build that self-confidence in ourselves that at times we could be struggling with our mental health. You know, so being able to do that kind of helps us. Being able to enhance it and change your routine. You know, if we're kind of stuck in this area where we're not feeling like we're moving, we're not feeling like it's doing us any good, you know, sometimes being able to, you know, change a portion of that routine that is making us not feel so good about ourselves. Being able to add things to our routine that we know is going to have a positive effect. You know, we kind of wake up, have breakfast, go to work, come home, have dinner, do a few things here or there. But if that's kind of the routine that is putting us kind of in this sense of not having good mental health, how can we change that? How can we do that? And being able to challenge yourself. A lot of these things are hard. A lot of these things are hard to overcome. And if we don't really challenge ourselves and push ourselves in a lot of these different areas, it's going to be really difficult for us to kind of overcome some of the challenges that we're going through. Sometimes it's very easy to be content of where we are. And if we're not challenging ourselves to overcome these things, it's going to be pretty difficult to overcome some of these things. So those are just a few of the things. You know, it all depends on our person, the things that do work and don't work. It could be completely individualized, and what that looks like. So that's also something to keep in mind as well. So I'm going to send that back to Amy.
Great. Thanks so much, Alvis and Victoria and Kayla. Before we go to some questions, I just want to provide just a little bit of information about how you can access Lutheran Community Services, and how you can connect to our mental health first aid. So one of the things you can do is join an LCS office newsletter. We have newsletter that goes out about every quarterly, and it gives you information on things that we're doing, things that are working, just all kinds of different things. Each of the districts have their own newsletter, so if you are closer to a different area for Lutheran Community Services, we can also get that information for you. You can go to our website, lcsnw.org, and that has every program, every information, how to connect with the Tri-Cities office or any other office as well. You can also donate there, whether you would like to donate locally to the Tri-Cities, or if you want to donate to LCSNW as a whole, and the money goes where most needed. You can do that. And then also, I know they dropped the link in the chat a few times, but there is mental health first aid. I think there's 11 classes that we're holding through the rest of the year. So if you're interested, I highly suggest at minimum taking that class. All right, so let's go ahead and we're going to go into our Q&A. Please know if you do have any more questions, the Q&A forum is still open, and please feel free to go in there and drop a question. But right now, I am going to reach out to some of my colleagues on here, and we're going to answer a few questions. So the first question from Anonymous we have, are you seeing different or increased needs in the youth mental health as a result of the pandemic? Alvis, I'm going to turn this one over to you. You I know have a lot of information in this background.
Yeah, so like as everybody knows, kind of going through a lot of that pandemic, we've seen a lot of services also slow down, just because of the nature of how everything worked out during that time. So we have seen a big increase in the services that are being requested, and not only here locally. In one of the links as well, that there's a lot of information regarding that the White House has released that has been done about how has mental health increased. The amount, it went from, I think, if I'm not mistaken, it was 1 out of 10 individuals with mental health, and it spiked that all the way up to 4 out of 10 individuals who now have identified that they have a mental health. So it really has been something that within our community and the youth that we see, we're having a lot of these challenges of mental health. Whether if it was from isolation and not being able to do a lot of the things that they were able to do pre-pandemic, as a result of the pandemic, they've gone through a lot of traumatic events as well. So it's really something that we're seeing now, and we're seeing a larger number of youth being enrolled in our programs, whether if that's from healthcare providers, school providers, school counselors, principals, teachers. We're just seeing a large increase of those referrals being sent to us because of this pandemic that has come out.
All right, thanks, Alvis. If you have any more information on that question, you can email us directly. We're going to move on to the next one. So this one, I think this is a good one for Kayla. Are you seeing a higher rate of burnout with your colleagues? How can we as a community member support you as you do this critical work?
That is a great question. And unfortunately, the answer is yes. The folks that are doing the work, we are hearing and seeing more burnout. And we know the word burnout and we use the word burnout. But what we also see is an increase in compassion fatigue, and more challenges balancing work and life, because life has become a little bit harder for a lot of people. And so we have seen increases over the last couple of years. And how we can help each other. I think one, sending people our way, right? If you know people who are interested in helping people, and not just to us, but to the helping field, right? We've got lots of agencies in the Tri-Cities who are in a similar position. So increasing the workforce will help with some of it. Also, just understanding what those folks who are doing the work are going through. So attending this webinar, you kind of get a sense of what's going on and what the people that are doing the work are experiencing. So just understanding that, I think, is part of the help that we can do when as we're going through this.
Thanks, Kayla. I would agree 100% on all that. All right, next question. And I can actually answer this one. How are your programs funded? So my actual role here now is I'm the advancement manager. So funding programs is part of my job. As you heard from from Kayla, our WISE program is predominantly a Medicaid funded program. However, our other programs like mental health first aid, as well as our school-based behavioral health program, and anything extra that we do for families, including our Thanksgiving baskets and our Christmas, and even sometimes the chairs that our staff sit in, are all funded through donations and grants. So we kind of have a wide range of how we fund our programs, some from the state, some from local donors, some from larger organizations, whether that be like Hapo Community Credit Union, or supports from all over the community, both locally and statewide. But we're always looking for new opportunities to support these growing programs, as well as continue growing more programs so we can continue to fill gaps. I think we have enough time for maybe just like one more question. The question says, what about bullying? And my guess is that we're talking about how has bullying increased, and does it affect the mental health that we're seeing with our youth? Victoria, do you feel comfortable answering this one?
Yeah, sure. So absolutely, there has been, since youth have transitioned back to school settings in person, the cyberbullying piece we kind of touched base on a little bit. There has been an increase, which we have seen that increase in the mental health challenges that come with the bullying. Speaking as a mental health first aid trainer, there is the opportunity in there where we address some of those things, and what we can do as those trusted adults to provide some support if we see that. A cool thing we didn't touch base on, mental health first aid also has something called teen mental health first aid. If you want more information on that, feel free to check out the website. But it goes through how to respond peer-to-peer. So knowing the impact that can be made in that avenue as well. But yeah, I would definitely say we've seen an increase, and just creates more need for us to have those trusting adults in those youth lives. Agreed.
Thanks so much, Victoria. All right, so before we just have about 1 minute until 1 o'clock, and I want to be conscious of everybody's time. So I want to thank everybody for coming today. Again, we apologize for the glitch, but we are glad you were able to come in and hear what we have to say today. As a reminder, I think it's been on there multiple times about mental health first aid, but please, if you get the opportunity, we've tried to make as many classes as possible. On top of ESD 123 here in the Tri-Cities is partnering with us to make sure that we can provide these trainings during the summer for teachers, for any school educators of any kind, youth group providers, anybody that'd love to have that. This training, we're out there for you. Also, if you'd like to support LCS and what we're doing here, we have a local Donate Tri-Cities link, as well as an LCSMW whole Donate Now. So those will be dropped in the link. And one last, if you have any other questions, concerns, you want to know how to get in contact with us, please email us here at the Tri-Cities office, and we will take care of your questions. So thanks for joining, and take care of yourself. Have a great day.